My name's Joe Wynn. I'm with the National Association for Black Veterans. We're headquartered in Milwaukee, Wisconsin, but I'm stationed right here in Washington, D.C. We've got a chapter here in the National Capital area, and we've been growing the membership base here for now about 9 or 10 years. Came over here today to FedEx Field to participate in the Veterans Health screening. One of the things we've been trying to do and have been doing now for this past year is partnering with many of the health organizations and our veteran service groups to reach out to veterans to inform them about medical organizations who can service them, provide services to them and their families who are outside of the VA medical system. We've found that probably over 75% of the veterans are not in the VA health system. But yet, of course, we all have medical needs. And so we would like those medical service organizations to begin to work with us to educate veterans that they already may be seeing anyway, but just let them know, identify them, first of all, as being a veteran, and then let them know that they are beginning to become aware of some of the medical and particularly mental health issues that may be more prevalent with some of our veterans.
Agreed.
Yeah.
And can you talk to me a little bit about the value of the partnership? You know, having the Washington Redskins, GlaxoSmithKline, Men's Health Network, your organization, and 12 other veteran service organizations. How does that make you feel when you look around the event today?
Oh man, this is incredible. This is actually, I'm looking out over there and I see the president of VVA, John Rowan, who has been organizing a Veterans Health Council. We're also a member of that health council, and the whole idea was to bring together these medical, what I keep calling medical service organizations, to work and partner with our veteran service groups. So to be here today and to see this begin to come together out in a real venue here within the nation's capital is incredible. The turnout here looks like we've got a really great turnout. I'm told that we had nearly 400 veterans registered to participate, and it looks like over the past few hours, it's been quite a few that have actually come out. So this is great. This is great. Real good venue. Men's Health Network. We're working with them. GlaxoSmithKline, American Heart Association. There's also a group, they're not here today, but the Black Mental Health Alliance and NAMI, the National Association on Mental Illness. We've been working a lot with them, as well as the Pfizer Pharmaceutical Corporation. We've, in the past year, have done 3 veterans outreach events here in the community where we have had discussion forums to talk about such topics as PTSD, post-traumatic stress disorder, other mental health issues. We've been talking about high blood pressure, cardiovascular disease, prostate cancer, that's a big one, diabetes, and also one that you don't hear a lot about is medication compliance, because we have a lot of veterans who are receiving, directed to take a number of different medications, and they don't always take them as prescribed, and that creates another issue. So we're beginning to try to educate more veterans about the importance of taking your medications as prescribed, you know, in the proper time. So, yeah.
That's great. And can you tell me about the different screenings we provide? Because you mentioned prostate cancer, diabetes,
right,
you know, the high blood pressure, the mental health issues. You know, when you notice the screenings today, do you think you know, we've hit that target right on the head for veterans health?
Oh yeah. I've even seen a few around here that I wasn't aware that they were going to be doing. Particularly the blood pressure one. You know, that's one they do a lot. And I understand with the prostate cancer, they're doing the full screening for the men. They had to taking them in the back room and checking them out, trying to really see if you know, that prostate has enlarged and whether or not they need to go for further treatment or tests, and that's good. And looks like they've got all the stations active, and you know, folks are stepping right up. And I've noticed there are even lines at some of the stations. So, you know, a lot of people are willing to come forward and get these tests. And hopefully they'll follow up if it is determined that they need to do so. Yeah,
absolutely.
Right.
And, you know, as you think about as we move forward from here, do you see other partnership opportunities as kind of like a final thought you'd like to share with us today?
Yeah, one of the things we'd like to see happen a bit more is not only events such as this, but we need to have more discussion forums, I think, out here in the community, along with the veteran service organizations and the medical service groups, to have veterans and their family members come out and let's talk about what's going on with you within your household, within your family, so that we can try and, unfortunately, particularly with the mental health issues, we have a lot of veterans who have considered the mental issues to be a stigma. If you come public to talk about it, people don't want that to jeopardize their employment, which, that's understandable. So, but if we have more, I think, open forums to discuss these type of things, it desensitizes a lot. And then they can follow up for treatment, whether it's in the VA or not. And that's the important thing we're doing here with these partnerships, is that veterans and their families have alternatives to the VA medical health care system. Right.
Well, Joe, we really appreciate your partnership. It's a pleasure to have you today. Good sir.